upper limb classes, right? Upper limb. In the upper limb, there is a presence of number 1 is the clavicle, and number 2 scapula, and number 3 humerus, radius, and the 8 carpal bones, 5 metacarpal bones, and 14 phalanges. Okay. So now we discuss the clavicle. Okay. So clavicle, first side determination points of the clavicle. Side determination points of the clavicle. See here. Medial end is a quadrilateral end which faces medially. So medial end is a quadrilateral end which faces medially. Next, anterior two-third parts. See here, and this is a two-third part. Two-third part is convex forwards. Medial two-third part convex forwards. Second point. Okay. Then lateral end is a flat end. Lateral end is a flat end. Then inferiorly there is a presence of groove called as subclavian groove, which faces always downwards. Which faces always downwards. Are you getting? Yes. Medial end is a quadrilateral end which faces towards the medial side. Then medial two-thirds is a convexity forwards. Then lateral end is a flat end. Then subclavian groove faces downwards. So these are the side determination points of the clavicle. Are you getting now? Next, come to the parts of the clavicle. Parts. It consists of mainly 1, 2, 3 parts. 1, 2, 3. So number 1 is the medial end, and number 2 is the lateral end, and number 3 is the shaft. Medial end, lateral end, and shaft. Okay. So medial end is a quadrilateral end which is articulates with the manubrium sternum. See here, which is articulates with the manubrium sternum, like this. Then forms a joint called as sternoclavicular joint. Forms a joint called as sternoclavicular joint. So this joint is enveloped by the fibrous capsule. Enveloped by the fibrous capsule. Okay. Then come to the lateral end. So lateral end is articulates with the acromial process of the scapula. Acromial process of the scapula, like this. This is the acromial process, and this one is a lateral end which is articulates like this. Okay. Then forms a joint called as acromioclavicular joint. Acromioclavicular joint. So medial side a joint parenti. Medial side end joint is sternoclavicular. Lateral side acromioclavicular joint. Then come to the shaft. Shaft is subdivides into two parts. Shaft subdivides into two parts. Medial two-third part, lateral one-third part. Medial two-third, lateral one-third. So medial two-third part is a cylindrical part. It is a cylindrical part and a round one. Then lateral one-third part is a flat part. So medial two-third part is a cylindrical part. Lateral one-third part is a flat part. So first we discuss the medial two-third part. Medial two-third part, it is a convexity forwards. It consists of superior surface, anterior surface, posterior surface, inferior surface. 1, 2, 3, 4. It is a cylindrical part. So superior surface, anterior surface, posterior surface, inferior surface. Then lateral method consists of superior surface, inferior surface, anterior border and posterior border. Superior surface, inferior surface, anterior border and posterior border. Okay. Now we discuss the medial two-third of the shaft. There is an attachments of the medial two-thirds. See here, observe this picture. This one is a superior view from the above, called as superior view. Now, the superior surface of the medial two-thirds, there is a origination of sternocleidomastoid muscle. So here there is a origination of sternocleidomastoid, which means one head is arises from the sternum, another head is arises from the clavicle, which runs up to the mastoid process. This muscle we called as sternocleidomastoid. Once again, I draw the diagram. Mastoid process. The sternum, the clavicle, right? So sternal head, clavicular head runs up to mastoid process. So this muscle we call as sternocleidomastoid. Sternocleidomastoid muscle. So here origination, which head? Clavicular head of the sternocleidomastoid. Clavicular head of the sternocleidomastoid originates from the superior surface of the medial two-thirds of the clavicle. 1 point, right? Next, come to the anterior surface. Medial two-thirds, anterior surface. The medial two-thirds, anterior surface, there is the origination of pectoralis major muscle. Pectoralis major muscle. See the pectoralis major muscle. See here, this one is a pectoralis major muscle. So pectoralis major muscle, it is originates from the anterior surface of the medial two-thirds of the clavicle, some fibers. And some fibers originates from the sternum, manubrium sternum, and body of the sternum up to 6th costal cartilage. Up to 6th costal cartilage, then it runs towards the lateral side by the twisted manner, finally which is inserted into the lateral lip of the intertubercular sulcus of the humerus. Lateral lip of the intertubercular sulcus of the humerus. So this one is a pectoralis major muscle. So pectoralis major muscle లో కొన్ని ఫైబర్స్ ఎక్కడి నుంచి ఆరిజిన్ అవుతున్నాయి? యాంటీరియర్ సర్ఫేస్ నుంచి. సుపీరియర్ సర్ఫేస్ నుంచి కొన్ని ఫైబర్స్ ఏంటివి? స్టెర్నోక్లీడోమాస్టాయిడ్ ఫైబర్స్ అనేవి ఇక్కడ నుంచి వస్తున్నాయి. ఓకే, దెన్ కమ్ టు ద posterior surface. Okay, in the posterior surface there is the origination of posterior side. So in the posterior surface there is the origination of sternohyoid muscle. So sternohyoid fibers originates from the posterior surface. So posterior surface sternohyoid అన్నవి ఇక్కడ చూడండి, the hyoid bone. This one is a sternum. Some fibers originate from the clavicle also. So this muscle we called as sternohyoid muscle. So sternohyoid muscle, some fibers originates from the posterior surface of the medial two-thirds of the clavicle. Okay, ఇట్లా ఉన్నప్పుడు ఇక్కడ నుంచి వస్తుంది, right? Is it clear? Next, come to the inferior surface. The inferior surface, so there is a presence of one ligament. Inferior surface, there is the presence of one ligament called as costoclavicular ligament. Costoclavicular, which means the first rib. See here is the first rib, and above the first rib there is the presence of clavicle. So between the first rib and clavicle there is the presence of one ligament called as costoclavicular ligament. Once again I show you. Costoclavicular ligament. Observe this picture. So this one is a costoclavicular ligament. Are you getting now? Next, another point, inferior surface. In the inferior surface there is a presence of depressed area called as subclavian groove. Subclavian groove. In the subclavian groove there is an insertion of subclavius muscle. Subclavius. Sub అంటే below. Sub inspector అంటే ఇన్స్పెక్టర్ కంటే కింద అయిన. Subclavian అంటే clavius అంటే clavicle కింద. So subclavius muscle. So it is originates from the first rib. ఎక్కడి నుంచి ఆరిజిన్ ఉంది? First rib. Then it is inserted into the subclavian groove. Here insertion point. ఇక్కడ చూడండి, four surfaces లో superior surface origination of sternal clavicular head of the sternocleidomastoid. Then anterior surface there is the origination of pectoralis major muscle. Then posterior surface there is the origination of sternohyoid. Then inferiorly only there is a insertion. So insertion of subclavius muscle. So subclavius muscle originates from the first rib. Then it runs above, then inserted into the subclavian groove. Are you getting? Medial two-thirds completed. Then come to the lateral one-third. Lateral one-third consists of two surfaces and two borders. Superior surface, inferior surface, anterior border and posterior border. So superior surface is a smooth surface, inferior surface is a rough surface. Superior surface is a smooth, inferior surface is a rough. And anterior and posterior border. So in the anterior border, see here, like this. So in the anterior border, there is an origination of anterior fibers of the deltoid. Anterior fibers of the deltoid originates from the anterior border of the lateral one-third of the clavicle. అంటే చూడండి ఇట్లా ఉంది కదా anterior border. In the anterior border there is an origination of anterior fibers of the deltoid. Originates from here. Okay. Then come to the posterior border. In the posterior border there is a insertion of the trapezius muscle. Insertion of the trapezius. Origination of the deltoid. So actually this deltoid muscle, it consists of three types of fibers. Anterior fibers of the deltoid, intermediate fibers of the deltoid, and posterior fibers of the deltoid. Anterior fibers of the deltoid originates from the anterior border of the lateral one-third of the clavicle. Then intermediate fibers originate from the lateral border of the acromion process of the scapula. Then posterior fibers originates from the inferior lip of the spinous process of the scapula. Inferior lip of the spinous process of the scapula. So మనకి ఇవన్నీ అవసరం లేదు, ఇక్కడ కావాల్సింది ఏంటి? ఓన్లీ టూ మజిల్స్, ఒకటి ఆరిజిన్ ఒకటి ఇన్సర్షన్. ఆరిజిన్ ఏంటి ఇక్కడ? deltoid muscle origin. A fibers, anterior fibers. So see the deltoid muscle. Once you see the picture of deltoid, see here is the deltoid muscle. Anterior fibers originates from the deltoid. So anterior fibers anterior fibers arises from the anterior border of the lateral 1/3 of the clavicle. Then intermediate fibers also called as acromial fibers. So lateral border of the acromion nunchi vastunayi. Then posterior fibers arises from the lower lip of the spinous process of the scapula. Lower lip of the spinous process of the scapula. ఇట్లా ఉందనుకోండి, యాక్చువల్గా ఇది వేరేది ఆర్టికులేట్ చేయడానికి కొంచెం మీరు ఇవన్నీ చూసుకోవద్దు, ఓన్లీ ఇక్కడే చూసుకోండి. ఓకే, సో సీ హియర్ anterior fibers, okay, then acromial fibers and lower inferior lip nunchi posterior fibers of the deltoid. Are you getting? So anterior fibers, middle fibers, posterior fibers, intermediate fibers anochu, otherwise called as acromial fibers. Are you getting? Then come to the surfaces. So superior surface is a smooth surface, inferior surface is a rough surface. So why it is rough? Because there is a presence of conoid tubercle and trapezoid ridge. So because there is a presence of conoid tubercle and trapezoid ridge. చూడండి, ఇక్కడ ఒక tubercle ఉంది, ఒక ridge ఉంది. So that is a conoid ligament present in the conoid tubercle. So దాని మీద అటాచ్ అయ్యేది ఏంటి? conoid ligament. Then trapezoid ridge మీద అటాచ్ అయ్యే లిగమెంట్ పేరు ఏంటి? trapezoid ligament. conoid tubercle కి conoid ligament, trapezoid ridge కి trapezoid ligament. These two ligaments together called as coracoclavicular ligament. Coracoclavicular means, see here like this, coracoid process to clavicle. There is a presence of ligaments. There is a two ligaments. One is conoid ligament, another one is a trapezoid ligament. So both are together called as coracoclavicular ligaments. Coracoclavicular ligaments attaches to the inferior surface of the lateral 1/3 of the clavicle. Are you getting? Yes? Okay na? So ఒకసారి రిపీట్ చేయాలా, అవసరం లేదా? So once again I repeat, medial end is a quadrilateral end which faces medially. Lateral end is a flat end, faces laterally. Medial 2/3 is a convexity forwards. Then inferiorly there is a presence of subclavian groove, faces downwards. So these are the side determination points. Then parts: medial end, lateral end, shaft. Medial end is a quadrilateral end which is articulates with the manubrium sternum, then forms a joint called as sternoclavicular joint. The lateral end is a flat end which is articulates with the acromion process, forms a joint called as acromioclavicular joint. Okay, then come to the shaft. Shaft consists of two parts, subdivides into two parts: medial 2/3 part and lateral 1/3 part. Medial 2/3 part is a cylindrical part, lateral 1/3 part is a flat part. So medial 2/3 part consists of four surfaces: superior surface, inferior surface, anterior surface, posterior surface. So in the superior surface there is a origination of clavicular head of the sternocleidomastoid muscle. Clavicular head of the sternocleidomastoid. It consists of two heads. One head is originates from the sternum, another head is originates from the clavicle. So clavicular head of the sternocleidomastoid originates from the superior surface of the medial two-thirds of the clavicle. Next, come to the posterior surface. The posterior surface, some fibers of the sternohyoid muscle fibers originates from the posterior surface of the medial two-thirds of the clavicle. Then come to the anterior surface. In the anterior surface, some fibers of the pectoralis major muscle fibers originates from the anterior surface of the medial two-thirds of the clavicle. Then come to the inferior aspect. Inferior aspect, there is a presence of costoclavicular ligament, and also there is a presence of one muscle inserted here in the subclavian groove. So that muscle is a subclavius muscle. So it is originates from the first rib, runs above, then finally which is inserted into the subclavian groove. Then come to the lateral one-third part. Lateral one-third consists of superior surface, inferior surface, anterior border, posterior border. The superior surface is a smooth surface, inferior surface is a rough surface because there is a presence of conoid tubercle and trapezoid ridge. In the conoid tubercle, there is attachment of conoid ligament, then trapezoid ridge, there is attachment of trapezoid ligament. So these two ligaments together called as corococlavicular ligaments. Then superior surface no points leave. Come to the anterior border. In the anterior border, there is the origination of deltoid muscle anterior fibers. Deltoid muscle anterior fibers. Then posterior border, there is an insertion of trapezius muscle. Are you getting trapezius insertion?